Good afternoon, everybody. Now that we're all well fed and hydrated, I guess it's back to business. So today we are here for the patient portal panel, and we are honored to have our panelists here who will be sharing their expertise and experience on not just implementing the portal, but how it's benefited them and what challenges they've overcome. First, we have Donna Goldblum from Open Door Family Medical Centers in Westchester and Putnam counties, New York. They are an 80 provider, federally qualified health center, and they predominantly work with patients. 45% of their patients are uninsured, 93% of their patients have incomes 200% below the federal income level, and 64% of their patients are best served in languages other than English. So they've been very creative in their marketing despite this to be able to get the portal up and running. And as you can see, they currently have about 10,000 patients who are web-enabled, and 2,000 of them are active patients. Open Door also has received the HIMSS Davis Award in 2010, and they're currently level 3 for PCMH. And Donna has been with Open Door for 11 years now. She's currently serving as their business analyst as well as their system admin for EHR. And she'll be helping us understand how marketing helped them to be able to get their patients to adopt the patient portal. And Open Door has 5 main locations. They have 5 school-based health centers, and they also have 1 mobile dental van. Next, we have Melissa Austin from Tyler, Texas. Melissa has been a practice administrator at Tyler Internal Medicine for 7 years, and currently she's working for another practice called Texas Pain Medicine, and she's helping them achieve portal adoption as well. She's been instrumental in getting the portal live and be very successful at Tyler Internal Medicine, and they have what we consider a quick adoption. They went live with the portal in July 2012, and they've been able to get 57% of their patients web-enabled by December of last year. And as you can see, most of them are active, and they've just started implementing Healow and hoping to get some traction on that as well. What portal has enabled them to do is, 1, significantly cut down on the phone calls, especially for lab results and refills, and it has completely eliminated the printouts that they used to do for the patients as they check out. And with the high intake of new patients at Tyler Internal Medicine, Patient Portal has played a very key role in terms of pre-registration as well as getting information through the questionnaires. Next, we have Dr. Gregory Carlson from Texoma Care. They're primarily in Texas with 1 clinic in Oklahoma. They're a group of 55 physicians, and it's a multi-specialty group. They have internal medicine, cardiology, gastroenterology, podiatry, and they are currently in the early stages of ACO development. They've been live with Patient Portal since 2011, and they currently have about 24,000 patients who are web-enabled, and they've been implementing Healow since the beginning of this year. Dr. Carlson has been with Texoma Care for the last 17 years, and he's their physician champion, or super user as we call it, in terms of EHR. And we had the honor of him presenting at our 2010 conference on office design, and this year he presented on Healow and mobile device usage for eClinicalWorks. Next, we have Dr. Mark McNeil from Trillium Family Medicine. They're based in Asheville, North Carolina. It's a solo practice for family medicine, and what sets this practice apart is the high percentage of portal users. As you can see from their inception in September 2011, which is exactly when they went live with portal, out of the 780 patients they have, 719 of them are web-enabled, and out of which 685 of them are active users. Dr. McNeil believes in improving access for patients by eliminating barriers and has been recognized by Western Carolina Medical Society as a leader in the community for health innovations. He was also featured in the ABC Local News 13 for his new care model. Portal enables him to be a very high efficiency and low overhead practice, which makes more time for meaningful interactions with his patients. I'm going to now hand it over to Suhail so we can start our questions for the panelists. Thank you.
Good afternoon, everyone. Thanks, Shippa, for that lovely introduction of our panelists. So for the next, I want to say about 30 minutes, what we wanted to do is, based on our experience and using the experience of our panelists, we're going to ask them a few questions, have them answer these questions. And then after that, if you still have some more questions, we can take it in the last 15 minutes and the panelists can answer them. So you guys ready to get learned? So our first, our first question is for Donna as well as for Dr. McNeil. So in your words, if you could tell us what are some of the biggest challenges in implementing patient portal at your practice?
Hello. Hi there. So I think when we first got started, one of our biggest challenges was that we weren't quite sure how we were going to web enable everybody. And we started sort of on the wrong track by having the front desk, as they started with their appointment, they pushed that little button next to the email address and said web enable. But we forgot to tell the patients. And so what ended up happening was we had a whole bunch of patients that were web enabled, and nobody really knew what that meant, and they didn't have their user name and ID and password, and they never communicated with us. And so that was wrong step number one. Another issue that we have as being a community health center, many of our patients don't have computers, they don't have internet access, they may not speak English or read English to the level that we need them to, and that was another barrier. The third issue that I think we've struggled with over time, which I'm glad to hear in our new features, that we'll be able to have proxy access, that we can really identify a way to limit the access for the teenage population, because we do have an OBGYN practice. We have a lot of sensitive patient information. So what we did as an organization is we said nobody under 18 should be web enabled. And that really is a barrier to parents of small children, because that's obviously a great benefit. But we had no mechanism in place to turn it off at age 13, or even, I hope, we don't want to say age 11, but we try not to let those patients get web enabled. Those were some of our biggest challenges.
Thank you, Donna. Dr. McNeil?
Before I answer that question, I'll just give you a little more background on my office, so you can have a little bit of context. Before opening my office a year ago with the low overhead model, I worked in a pretty traditional high volume, high overhead office, seeing 25 patients a day using eClinicalWorks, and still found myself overworked and not having the level of satisfaction I wanted, and not finding my patients having the satisfaction that I would have desired. So envisioned a practice that would be much more low overhead, lower volume, and with just a completely different workflow altogether, really based around the patient portal. In my practice now, instead of traditional phone communication, we really use the patient portal for most of our communication both ways. Patients are trained to schedule all their appointments online, send their messages through the portal, get their refill request and lab results through the portal. To answer the question, the biggest challenge was just getting patients to trust the new system. In general, patients don't like having to call and wait on hold and play the phone tree, but that's what they're used to doing. And telling them that, hey, this is going to be easier and this is going to work, was a challenge at first. Most patients have a sick routine, and when you get sick, you call and call and call. We tackled that by some pretty aggressive marketing. Every patient had to go through we set aside a good 5-10 minutes of their first visit with my medical assistant to train them on how the portal worked and how to get their essential needs met, as in scheduling their own appointment through the portal and getting their messages to me. I'd also follow up behind my medical assistant and do a little training myself and tell them how important I thought it was, which really made a difference. After the aggressive sales pitch, my medical assistant and I made a commitment to give great service through the portal. Instead of letting messages sit there, we respond to most of them within 2 hours. Using the self-scheduling function, we able to provide open access, so patients rarely are unable to get an appointment when they need it. And they also get their lab results in a timely fashion. So that aggressive sales pitch and then giving them good service afterwards has been the key to our success.
And that number, again, from a usability and an active user, is that still at about 90%?
I have 90% web-enabled, and 70% of my patients use the portal primarily for all their scheduling and communication.
That's pretty fantastic, I gotta say. So if we can switch gears a little bit, we talked a little bit about implementation, some challenges. I know I think you've touched a little bit about marketing and if you're to do the portal again. So if you can talk a little bit about that, some marketing efforts, and if you were to start your implementation today, what would you do differently? So I think I'm going to direct this question to Donna, Dr. McNeil, and then Dr. Carlson.
You want me to start? Okay. Well, I mentioned before that we had an issue with web enabling from the reception desk, and I think we started that way, and we decided really that wasn't the most effective way. So then we tried to bring it into the exam room and have the providers and the clinical support staff do it. And we found that because we had so many other requirements to accomplish in that 10-minute visit, that 10 to 15-minute visit, we didn't have time to spend the dedicated event to get them web-enabled. So what we then did, which was our most effective, was we got volunteers to work in the waiting rooms and to actually have a table where we had a computer with access to the internet, and we brought people out of the waiting room and just had them sit there. They got web-enabled, and we logged them in so that they could see the benefits, because we noticed, and I know Sid Shaw mentioned this at his presentation, you can web enable everybody you want, but if they don't understand the benefits and they don't actually see it in real life, they're not going to get on it and use it. So we found that was the most effective, was having those people in the waiting room. So now we're trying to partner with the local community college and get an internship for students to come and be part of their human service majors to actually work in our waiting rooms. And that's our marketing.
Thank you, Donna. Dr. Carlson, you want to go next?
Sure. The challenge that our group faces was really more about selling the portal to the providers. If the provider believes in the portal and feels like it's going to provide better patient care and it's going to make them more efficient, they're going to adopt. Because if you've got a lukewarm provider, you're not going anywhere. No sales pitch is going to work. And so a couple of things that we leveraged. We're very aggressive with campaigning for meaningful use, showing physicians what they were going to earn if they were on board for meaningful use, and then just showing how much easier. And we had very clear emails. This is what it takes to get meaningful use in terms of patient summary, how many clicks clicking that patient summary after every visit, every single visit to be compliant, versus web enable on one time and you're done. That really makes the patient oversharing, the tsunami of emails from your patients when they're on the portal, it's more mythical than a reality. And so if you've got some physicians that are using it, that are super user physicians that can relate that to the physician, say, I've been using this for 3 months and I'm really have not been inundated with wasteful emails from my patients. And the story I told at our retreat was of a patient who had a terrible anxiety disorder. I've been trying to take care of this patient for years and get them to take their SSRI, to take their anxiety medicine. And invariably, they'd get super anxious. They would come in for a visit and start them on their medication. And at the first sign of a side effect, they would stop their medication, and I'd never hear from them again. Calling, getting on the phone and calling filled them with anxiety. They didn't want to do that. Well, this one patient in particular, every side effect he got, and I probably did get about 10 emails from this guy after his visit. But once he got on that medication was in his system for 6 weeks, 8 weeks, his anxiety was treated, and the email stopped. And here's a patient who I had been struggling with, and the portal allowed me to give him the treatment that he needed. So stories like that, and then finally empowering your physicians with a voice recognition program. I am a really slow typist. I don't spell well, and so to think of answering messages with typing is frightening to a lot of providers. But with the Dragon, and especially as we saw in the keynote, the evolution. If you haven't looked at the iScribe, the evolution of Scribe as a way that we can input our patient information is remarkable. And as far as delivering to the patient, I think if we can scribe our notes in rapidly and effectively, and we have a little bit of a gap because we've done that quickly, then we can address those messages in between patients. When I started doing that, it made life so much better, because instead of having 10 or 15 or 20 messages at the end of the day, which is just that big red jelly bean plump with 30 messages, is just soul crushing. So to just take care of those between each visit is remarkable, and voice recognition and portal can allow you to do that. And simple things. I had a patient the other day who was at the pharmacy, and I forgot to send one of their prescriptions. And they were Healow messaging me from the pharmacy, and I was able to blow the medicine back in versus them having to go through the receptionist. So empowering your providers. If they used Dragon 4 years ago, don't let that dissuade them. It is not the same animal. You really have to show them how much better it works now, and when you do that, they'll really be on board with it. It's costly, but for my practitioners, and I'd say we've got about 10% now, but I suspect with the iScribe we'll have a whole lot more using the voice recognition in the future. So,
Dr. McNeil?
Sure. I'll just comment quickly on what did and didn't work with marketing. I did spend a significant amount of time designing flyers and pamphlets and posters, and they all look nice, but I find just using those at first really didn't seem to make a difference. Patients will ignore that. I found they would ignore my front office staff when they said, "Hey, this portal, it's kind of neat, check it out." Very few actually picked that up. Things started to pick up when I realized my medical assistant really had to spend a significant amount of time. So that's the time, making sure they understand how to log on and understand the basic functions of the portal. But when things really got rolling is when I got involved. I think physicians, we sometimes forget how influential we can be. We just assume our patients ignore us, but they do listen sometimes. And me taking the time, even if it was just a small amount of time, to say, "Listen, this is important. I really want you to give this a try. This is how we're going to communicate, and it's going to be better." Patients really gave it a chance. And once they gave it a chance, followed up with good service, they're hooked. I really made a point when I was explaining it to patients to make the connection between using the patient portal and it leading to more time with me and allowing me to be more flexible. Explain that when they use the portal, I don't have to hire as many people to answer the phones. I don't have to hire as many people. That's not as many salaries I have to pay, and I don't have to see as many patients during the day. So I can spend more time with you here, and I can be more flexible when you need to see me. And that really connects with patients, and they kind of get it at that point. And so I don't let them leave without at least understanding the method to the madness of transitioning to a portal-based way of communicating over the phone rather than the phone.
One other point to that, one of the stories that we've shared with our physicians, and I've got a large geriatric population, and there's that illusion that geriatric patients don't get online, and so even if they don't, they often have somebody that will for them. So telling the story of a patient who, it's Sunday night, and you've got a fever and you want to get in to see your doctor the next morning, you may not feel comfortable with the portal, but I'll bet you have a granddaughter or somebody that does. And so involve them, and then you could potentially send an email to Nancy, my nurse, and then when Nancy gets there Monday morning, she has that message and she's going to call you and get you in at 9:30. And so you've got that access. When patients hear that they're going to have access using this new tool, then that's when they really get sold.
So let's change gears. So let me ask you guys a question. Do you think that these panelists over here are motivated? Definitely, right? So so let's ask them a reason. So what are some of the features of the portal that, as providers, as staff members, that you like of the portal, which we feel is a motivating factor so that you could convince your patients and other providers to use it and to promote it? I think I'm going to direct this question. We'll start off with Melissa. Please.
All right. My main job at Tyler Internal Medicine was a nurse first and foremost. And as a nurse, you get multiple phone calls about refills, about referrals, about, am I supposed to continue this medication? On the portal, you can get on there and you can see all of it. They can see who the referral was sent to, if an appointment's been made. They can see lab results. They can see what medications were started and stopped, how they're supposed to take it, if it's been refilled or if they need a refill. Another thing is, when we have lab results, how many of you really just order one lab on that patient? Doesn't happen. You're going to get 3, 4, 5, 10, 12, depending on the doctor. When you get those results back, your little jelly bean fills up quite fast. So the nurse could go through if they're on the portal, make it to where they can all be pushed to the portal, send it through, the patient then can go on, verify their results, see everything, and it's over. It does help with the meaningful use as well. Your lab results, patient's access, all of it. The best thing about it all is, though, the patients want to know about appointments. They want to know what they were seen for or why they have to be seen or when, well, I've got an appointment at 10:30 tomorrow, what's it for? They can log on and see what's going on with their health care versus calling you and talking to you about the 10 other things that came to mind while on the phone.
Thank you, Melissa. Dr. McNeil?
Sure, I'm going to echo some of Greg's comments on the self-scheduling function. The two things patients give me the most positive feedback is the self-scheduling function through the portal and also the message function and being able to message the doctor and get a quick response. So much of dissatisfaction from patients is the anxiety that comes of wondering if they're going to be able to see their doctor and when are they going to be able to see their doctor, particularly when they're ill, and feeling like struggling to navigate the system. Talking about scheduling, prior to setting up this model, before my patients, I mean, you're all familiar with this, if they were ill the night before, they'd have to wait for the phones to open up, call, play the phone tree, wait on hold, talk to the front office person, finally work out an appointment with their schedule. Well, now, when they feel ill at 10 o'clock the night before and they want to get in, they just get on and grab an appointment. It's done. Go to bed, sleep, know they're going to see the doctor in the morning. Don't have to plan their whole day around wondering if they're going to get in or not. They love that. it really helps build trust and rapport quickly when they know they can get in with you when they want to. It's amazing how many appointments I see scheduled at 2 o'clock in the morning, midnight, 6 a.m. A lot of those would have been phone calls. Through this, I'm able to take my own call, and people rarely call because they know they're going to get in when they want to. Patients love the messaging function. I mean, how many people in here have a physician if they know they can send them a message and hear a response within 2 hours? Probably not many. I see one hand. Great. 2. All right. Patients freak out when they can do that. I hear week after week, thank you so much for being available. Thank you for getting back to me quickly. This office is great. This is wonderful. Sure, I heard that periodically at my previous office, but it's 20-fold now. A week doesn't go by where I'm not getting praised with this new workflow.
Now, at this point, I'd like to share something. It's totally not planned, but since Dr. McLean, you brought it up. So a couple of years ago, I became a new dad, and I think it was 2 in the morning, and my son sneezed, and both wife and me ran down and like, what happened, right? And we thought we'd pick up the phone, call the doctor. It's just a sneeze, right? So luckily, our doctor was on the portal. Did send a message, and I think within 45 minutes, we got a response back saying that it's just a sneeze. So, I mean, it just felt so special just to get something back from the doctor's office. It was very, very nice. So I did want to share that. So speaking about, after we motivated your staff and obviously your patients, so if you can talk from an operational perspective, any efficiencies that you've seen after implementing both the portal as well as the app, if Donna and Melissa, if you can take that.
I think the biggest efficiency has been the messaging back and forth from the patient to the provider. And I think, there might be some people in the audience who have not started the portal because they are worried about this increased amount of messaging back and forth. And I want you to just put in perspective that every one of these messages could have been a phone call that was waiting on hold, just like you had said, with the, automated attendant, press 1 for this and 2 for that. And I think when a patient is required to put their thoughts into a message, they have to be, concise, and they have to get the point across, and they can't ramble on for a long time on a phone call. And I think that's been a big efficiency. And then the second big efficiency has been the ability to look at the lab results. And that's been overwhelming because I think that reduces the number of phone calls tremendously. And the fact that you can write your note in the lab and the patient can see that note as well as, the actual result. So those would be my 2 efficiencies.
Right. To elaborate on the message part of it, how many patients do you have that call and say they need to speak to the nurse or they need to speak to the doctor, and they don't want to go in detail with that person, and they're like, no, just have somebody call me. And so nurse has to call and say, okay, so what's going on, what is it? And it's something that if they'd have just told you in the first place, you'd been fine. Well, with the portal, they can. They can go in and type their own personal message, and they can send it straight to the provider. That way, there's no middleman, which frees up your phone tree. Another thing is on any kind of prescriptions. You can go in, send the refill, send them a message to the portal, prescription sent to such and such pharmacy, so that you don't get that call 2 hours from now. Well, the pharmacy doesn't have my prescription. Did you send it? All they have to do is just respond back to it. The lab factor. We would go through and mail hundreds and hundreds and hundreds of patients their labs because we don't believe in the no news is good news. No. So you're looking at 46 cents a stamp. This has reduced it to free. The patient signs up, you put it on there, you verify it, it's gone. You notified the patient, they have their access, it's over. So there's a lot of different functions you can find, such as again, on the referrals, who did you send me to? You don't have all those phone calls. But one of the biggest workflow things is your nurses. It frees up so much time from having to spend 15 minutes talking to the patient about their cholesterol. They can pull up the lab, they see exactly what the doctor said. If you send in a medication, change to medication, it's there. And so therefore they feel like they're talking one-on-one with the doctor versus talking to the middleman.
Dr. McNeil, you have something that you'd like to share? The uniqueness,
Sure.
as we discussed.
Yeah, there's one other feature that's been a great, in addition to everything, I could completely agree with everything that's been said so far. There's one feature on the patient portal that our office uses significantly is the web interview. This is basically a product called Instant Medical History that's been uploaded to the interfaces with the patient portal, where the patient can fill out a questionnaire based on their chief complaint or chief complaints coming in prior to the visit. We train our patients to do this prior to every visit. Frequently it gets done before they come in, which is great for pre-visit planning. It focuses the patient on what they're going to talk about that day, helps them get their thoughts out. It allows us to plan for the visit, know what I'm getting into before I go into the room. And it also takes care of the subjective of the note for me. It comes in as a telephone encounter, which can be copy and paste right into the subjective of the note, and that's half the note is already done for me, done by the patient. That's a pretty significant workflow efficiency. If patients don't have time to do it before they come in, we have computers set up in the room and in the waiting room for them to do it. The other beauty of that is that they have to log in with their username and password to do it. So this becomes routine when they come into their office. So that one big problem with the patient portal is patients forgetting their username and password. But this is, by instituting this system, patients get that frequent reminder. It's just part of the routine of the office is that they're going to be logging into the portal every time they come in. So it solidifies that. If you haven't looked at Instant Medical History, it's a patient interview software. We've got about 70,000 questions. I have no relationship to them. I'm just a big fan of the product. But many of you may be familiar with bubble sheets, but it's like bubble sheets on steroids. It's kind of like having a third-year medical student in your office. Frequently, third-year medical students get great histories, ask questions that I will forget to ask, and it's very helpful. Occasionally, a third-year medical student goes off on a tangent, and so does this. But usually, the histories are very helpful.
And you can choose not to import that as well, correct?
Correct. If it ends up not being helpful, you just leave it out of the note. Yeah, you see it before you import it.
So actually, we're going to keep the questions till the end. But since you put your hand up and you stretch your shoulder out, we'll take your question.
Medical records, and then they distribute them to providers, and that's partly because our schedules are pretty variable and people are out or in. Can you have a pop-up message so that if I've entered into ECW that I'm out of the office this week, that if they directly try to email me, it would pop up and could reroute their message to a medical records staff?
There is a pop-up that will come up. It's one of the settings that you can put that you're out of the office, and it puts a big block to where messages can't be sent. But then you will have to find a person to redirect to. Like if you wanted it to go to, does medical records have their own box?
Yeah.
Then it could go to there. Yes, ma'am.
And I also want to say, I mean, in our situation, all of our messages are coming to our call center group, and they are redirecting them. So they know the schedule of who's in and who's out of the office. So if they know that Dr. X is on vacation, they'll know to redirect it to the covering provider.
Because
Okay.
they're generally the people who are having to spend less time on the phone, so they use that time they would ordinarily be on the phone, if it's to go into the phone room, to redirect those messages, and they know who's covering for whom, and so they just direct the messages to the appropriate
So the
coverage
messages are never directly going to somebody. They're okay.
No.
Okay. And then where did you say you got those bubble forms? What?
Well, they're not the bubble forms. I was saying they're better than, in my opinion, more thorough than that. It's called the web interview, and you can turn it on within the settings or have it or put in a ticket and have it turned on. There is a small monthly fee for it, but it's about around $15 a month the last time I checked, and well worth the investment.
And that company's been around a long time, and they do really, really well.
$15 per provider?
Per provider per month.
Uh-huh.
I mean, y'all can correct me if that's not up to date. But
We trust you, Doctor.
okay.
So I'm actually going to skip over this next question. I think it's been answered about the greatest benefits from a provider's practice. You know, I think the panelists have done a pretty good job in answering that. Let's talk about Healow. Dr. Carlson, if you want to take this about, you know, if you can talk to us about specifically about the app, you know, from both the marketing perspective as well as from what you feel, you know, from a key feature perspective, the patients will benefit from.
So we kind of took a similar approach as far as Healow. You have to convince the physicians and the medical assistants that this is going to save them time and that their patients are going to like it. It helps for them if they're patients in your practice to go ahead and have them open it up for themselves. I have it on my phone. If I get a skeptical patient, I just whip out my phone and show them exactly how it works, and they're sold. Our process was to hand out to give every patient that came in the office a handout, and to tell them to, if they had a smartphone, to go ahead and download the app while they're waiting in the waiting room. What happened for a little while is I would try to get them to download it when they were in the room, and invariably maybe their granddaughter knew the Apple ID number and they didn't know it, and so they had to call their granddaughter. So if you can get that sort of started before they come in the room, that's very beneficial. And what's different from Healow is, what's different from the patient portal is you hand them that username and password, and you just kind of cross their fingers hoping they're going to log on. Whereas with this, if they've got their phone with them and you start that process at check-in, by the time you get in the room, hopefully they've got it loaded, or by the time your MA rooms them, if they don't have a username and password, because some of my newer patients, maybe they're not on the portal yet, so their first introduction to this connection to your practice can be the portal. So they download the app at check-in, and your nurse comes in, and they get to the point where they need a username and password, and they're told how to pick your clinic and pick your physician with the handout, and then they just need to put in their username and password. So here your nurse rooms them, your MA rooms them and hands them their username and password, and while they're waiting for me for the next phase of their care, they can put in that username and password, and then they've got the app going right as soon as you see them. And then you just try to show them how cool it is by ordering a medication for them, and you order that medication and you say, you know, that medication is going to be on your Healow in just a few minutes here. And when you get that medicine on your Healow, you can bring it up, you can set an alert, it can message, or it can send an alarm on your phone when it's time to take that medicine. You can specify whether or not it's with food. You guys have seen the demonstration. And that's, for them to see the power of it right after that visit is a huge part of selling the app. And so getting your medical assistants to believe it and your physicians is a big part of it. What's nice is if you're portal users and you sign up for Healow, then the portal will email your patients a notice that, hey, join Healow. This is a new offering by your physician. And so I've had some patients who, they didn't need all the coaching by my check-in people. They already had the Healow on their phone and had been looking at their medicines and their labs, and they were doing it right away. The other neat way that patients use it that I didn't learn about until a patient came back and said, you know, your labs, I went to the nephrologist and he wanted to know what my creatinine was, and you hadn't sent it to his office yet, but I just pulled up my phone and showed it to him on my phone. That was really awesome, you know, for them to have that kind of power and control over their data. Very impressive for the patients. The visit summary is another opportunity. Your patient can, when they go to their appointments, and all their appointments are logged over time, So as we start to use this year after year, they can go back and see, I saw you, when did I see you last? Oh, 3 years ago, and what did we talk about? Well, if they choose to, there's a notes section, so they can put in their notes section before they see you, what are the main questions you want to ask? That takes some training, some patients are compulsive and do that, some don't. Or what were the points that you went over during the visit? And they can go ahead and put that in the notes section so that a year later or 3 months later, they can revisit that and go over the high points of of the visit. So, and then now, if you've been to any of the lectures on the new Healow, to get biometric data fed into Healow is going to be very, very exciting. Fitbit and up, these devices that your patients can wear that track their steps and track their activities. The MyFitnessPal that they can keep track of all the calories that they're taking in, the foods that they're taking in, and to have that uploaded to Healow. Very, very exciting ways for us to coach our patients and to stay connected to our patients. I have one individual who their employee program uses Fitbit, and if they don't get to a certain number of steps, they get a little ding, and they don't lose some reward through their employee wellness program. Now, what she told me is she can watch American Idol and just put it on her foot and go back and forth with her foot, and then she gets her steps. So obviously it's not foolproof, but it's coming. I think those are the main points on.
So let me ask this question. So in your experience and feedback that you've got from patients, especially on Healow, the remembrance of the 4-digit PIN
Good point.
over the username and password for the portal benefits?
Oh, yeah, I meant to say that. That's huge. Because very often, you've sent the patient out with this username and password, and it's case sensitive, and they just, their eyes cross when they look at that, and so they may not do it. But when they just have to remember that 4-number PIN, it's so much easier. I've heard of physicians saying, my patients don't need another complicated username and password, and often they don't. That is a hassle with the portal for certain patients. But this PIN is super fast and easy, and so the adoption and continue use at whenever. I've logged on multiple times just to show my patient, and it's so fast and easy, whereas to get on the portal takes quite a few steps. So good point. That really, really, I think, has boosted adoption and usage in our clinic. Not in my clinic. Nobody's come in and said, my daughter knew my PIN and she found my labs. And that certainly, but it could happen with that username and password left on the coffee table. And, certainly it's easier to do bad things, but still, I think the worth of the access really outweighs those concerns. But there's certainly valid concerns, and can you speak from an eClinicalWorks perspective as to whether or not that's been
We haven't heard anything about privacy or somebody else picking up. Phones, from what it used to be to now, the recent surveys that's happening. I think there was a recent survey out there saying that everyone who has a phone or a smartphone, they look at it about every 7 seconds. So it's basically attached to your hip. So the chance of anybody else taking it and actually knowing your PIN and checking.
I think if you have concerns, a lot of the phones have to check in.
Oh, yeah.
You've got a 4-number PIN just to open your phone up. So, if you have that 4-number PIN and a different 4-number PIN to get into Healow, that might provide you with a little bit of added security.
Yeah, and just to add to that, when they initially sign on to Healow, they have the terms and conditions, like a consent form that they have to read through and accept that they take responsibility for their information by using the app through their phone. And if they're not actively using the app, it logs them out automatically so that they have to re-enter the PIN if it's been idle for a few seconds.
All right, and then we've left the scary question for the very end, from a software vendor as well as a software engineer perspective. I know this is that probably there are no additional features that you'd like to see, but in case you did, if you could tell us a few. Dr. Carlson, Dr. McNeil.
Yeah, I've mentioned the self-scheduling function numerous times and how important that is. I'm excited to see version 3 of the Healow app having open access. I know you're still gonna have to confirm it. Doesn't have the ability. The patient doesn't have the ability just to take the appointment and that be it. That would be a great improvement. Because again, that's one of the things my patients love about the patient portal, and I want them to love about Healow, and engage them there. The web interview that I talked about before was using the 2009 version, and there's a number of updates that make it more. You can adjust it to physician preferences a lot easier with the update. So an update with the web interview software would definitely be appreciated.
Dr. Carlson?
I think there's some opportunities to link patient education to the portal. For instance, some physicians are worried about sending their labs and sending labs to the patients. You all get this. You send a CBC and the monocytes are high, and the patient's all upset about their monocytes being high, and they give you a call and they call your nurse. And so, embedding a link, a little asterisk next to an abnormal lab, and whether it's just a quick little educational sheet, or I'm interested in using educational videos that are personalized by the physician as an opportunity. So whether it's the diagnosis of plantar fasciitis that has a quick link to an educational video, or an abnormal lab, but having the ability to have your patients easily access patient education. Because I think we've all looked at CRAMES and we've looked at the ones that are out there, but they don't say things the way you want to say things, or your population responds to things, and it's not you. So to have both for us as the 84,000 physicians and people using eClinicalWorks, a big broad menu of patient education options, and being able to pick those and embed them in eClinicalWorks patient portal. I think there's some real opportunity there. And then I'm very excited about telemedicine, and doing telemedicine through Healow and through the patient portal is going to be very, very big. We've got to figure out how to do that and how to get paid for that. But it's if you Sid and Ganesh had talked about this in the Healow lecture they went to, putting on your patient brain and thinking about how wonderful as a patient that would be to be able to access your physician for that sneeze, to be your doctor doing a telemedicine visit for that sneeze, not at 3 o'clock in the morning. You have to wait till the next day for that. But how wonderful that would be to achieve. Another area of interest to me is group medical visits. The power of group medical visits. We look at the shortage of providers. How many of your diabetic visits could be done as group visits? I've done group medical visits in our indigent clinic, and wow, they really are powerful. What you get is there's kind of a different lecture, but you get patients. You can tell them your spiel, but when diabetic A starts telling diabetic B about how they do things, and they get competitive, and they come back and tune in 3 months later, and to have a group of people and to be able to do tele-group medical visits and get paid for them, wow, that'd be great. So certainly a lot of opportunities.
Excellent. Not at this time. What's in the works right now is that the providers will be able to publish documents to the patient, but we're not doing it the other way around. Not from the patient. Scary idea, but right?
Of course, your friends do that already on they text you.
Yeah.
So let's be honest. Yeah. Your Aunt Bessie sends them to you.
So we can actually open it up for questions now. We have a roaming microphone and in the center, so if you guys want to come up. Thank you.
Okay. I have a question for Donna. When your practice web-enabled, hi. When your practice web-enabled all your patients without mentioning it to the patients, I know of a practice that also did that. I wonder how you remedied that.
Well, it wasn't that it was about a quarter of our patients, but what ended up happening was then we had to go back and try to reach out to those patients. So we, as you saw from our slide, we really only have about a quarter of our web-enabled patients who are active users. And so we're struggling with that. We're trying to get our web-enabled patients to use it, but we have to do it on when they come in.
So did you run a report from either EBO or how did you identify those patients?
We identified them because we asked ECW to run a report and give us all the patients whose username had an @ sign in the username, and that meant that it was their email address instead of the first name, last name, year of birth. Mm-hmm.
Okay. Just earlier, I think the gentleman on the left, I'm sorry, I don't remember your name, said that the patient did your note for you. Those were the words you used, that by doing some paperwork before the appointment, they did your note for you. What were they doing with the portal that was giving you data that you could put right in your note?
Sure. Again, I'm Mark. My name is Mark McNeil. The product is called Instant Medical History, and it's embedded within the portal. If you click on questionnaires on the left, there should be a tab that says Web Interview. It does need to be turned on in the settings, and you do have to sign up with eClinicalWorks and pay the $15 per physician per month to use it. But it's the function within the product is called Web Interview.
So web interview, but instant medical history?
With instant medical history is the third-party product that's been sucked up into that, yes.
Okay. And then just another question I had. It has been presented to me by attorneys. There are legal implications with what is going on here. Are we saying that ECW is a very big company and has done the research that the Healow and this communication, when the patients sign that particular, app agreement, that we're covered there? That's basically what that is? Or are we as an individual practice looking at some liability still? Because I haven't gotten the sign off. I haven't revisited this, but I hadn't got the sign off when I was looking on that.
You know, I belong to a rather large group and of a large hospital system, 13 hospitals, and there was like a year delay in getting patients on the portal. They sent it to their legal team. They looked at it. They were just really worried about issues like this, and finally they acquiesced. This was in 2011. So that was portal. Luckily, we just kind of turned on the Healow, and we didn't really ask.
So you got the clearance with portal, but we're still not sure.
But Healow, yeah, it's an interesting question.
And does ECW presenting anything or is where did that terms and agreements comes?
It's on the patient, completely on the patient.
It's
up to them to download it and use it. So it's for their benefit. There's no liability. It's not on ECW. No.
Okay. And then I did hear something about payment for telemedicine at the initial. Do we have any date? Did I hear anybody know what date we're going to see Medicare payment for telemedicine?
I think he said 2015.
Yeah, he said 2015. That's what Girish announced.
He said January 2015?
15?
Is that what I heard? Okay.
That's what was on the keynote. So
yeah,
if we get more information, we'll post it on my.eClinical.
Thank you.
Sure. Guys, just a quick time check. I didn't want to interrupt. We have about 5 minutes, so if we can't answer your question in the next 5 minutes, we can step outside, and the panelists, if you can wait back, we can answer. Okay,
I just have a question about self-scheduling. 2 drawbacks. Is there a lot of no-shows, or I have patients who reserve multiple spots so they can have them and then cancel right before? Do you see a lot of that with self-scheduling?
Since implementing self-scheduling, actually my no-shows have gone down quite a bit. if I do this open access model, so I'm not making patients schedule their follow-up appointment when they leave. I say, hey, I'd like to see you in 6 weeks. I'm going to leave that, there'll be an appointment available within a few days. Just grab on when you know it's convenient to you. So they're able to pick an appointment within a couple of days when they know their schedule better, and they're less likely to cancel that appointment 6 weeks out or not show up. So my no-shows have decreased significantly because of that. And about the patient scheduling multiple visits, that rarely happens. Occasionally somebody goofs, but it's a rare event, and we normally catch it if it happens.
How do you give the patient a reminder? Do you give them any kind of reminder to come back in 6 weeks? How does that go?
Sure. For the high-risk patients, I'll typically create an action.
Oh,
if I have,
okay.
right, and if I'm really worried about that patient, I'm worried, and if I haven't heard from them, yeah, we'll send them a reminder.
How soon after? Do you wait till, like, if it's a 6-week follow-up, 7 weeks to get
Yeah.
that action, 8
Yeah,
weeks? Just
right.
kind of.
You're like a week after. Kind of depends on the situation. And we also run registry reports for different diseases. I mean, my diabetics, my COPDers, hypertension, if I haven't, coronary artery disease, if I haven't heard from them in 6 months, they get a message. So
Right.
we tend to go back and fish for those. And that is a little extra work, but it's not near as much as dealing with cancellations
Right.
and trying the workflow of scheduling them on the way out. Just empower them and turn it over to them.
Donna, my question is for you. 60% of our patients speak Spanish. How did you market to your non-English speaking with a English-only portal?
Well, that's a very good question, and that's on my list of features that I'd like to see, which I was told maybe someday soon. What we did was we labeled the links on the left with the Spanish translation, and all of our providers many of our providers are bilingual, so if the patient actually can navigate to make a message, then they write it in Spanish, and the provider will write back to them in Spanish. Labs, there's nothing we can do about that. The HealthWise that we have on the portal has a Spanish link, so we have that information. We have all of our messages, the reminder messages, and the email messages to go out. Those are all translated.
We have that too.
Yeah.
All right, thank you.
But it's challenging.
This question is for Donna as well. You mentioned at the beginning that one of your initial concerns was your economically disadvantaged patients and maybe with limited web app access, and that's my problem as well. I have at least half my practice is the indigent care surgery clinic, so that's my concern in getting this up and running. Did that turn out to be as big a barrier as you thought it was, and how did you get around that?
Well, I think that some of our patients have smartphones and they're able to use the app, but even more, they're able to go online to the portal on their phone. We're not quite as well adept at Healow, but we do encourage patients to make use of the public computers that are available in the local libraries. It may not be as efficient for them, but if they want to do it that way, they can.
What's the response been to that? Have they been responsive to doing that, or has it been harder to get them
It's been
out
harder.
of it?
I can't deny that it's been harder.
I think one of the New York City clinics I heard have kiosks, and they just have them do Gmail accounts. Have you guys thought
Yeah,
about
we do
that?
have the volunteers that help web enable people. We're also helping them to get email addresses and start from scratch so that they could use the portal that way.
Hi, I'm a pediatrician, and I'm aware that you can download immunizations right off the portal. Can you access some kind of school physical form, annual physical form that way? Anybody aware?
No, none that I know of.
Yeah,
'Cause
no,
I don't think the visit summary from that annual physical.
Right, that would be wonderful. Yeah, send it right to the coaches or to
Right.
the yeah, it would be
Okay.
great.
And also, in terms of confidentiality, obviously our population is all under 18. Is there any way to flag certain information as confidential, certain diagnoses, certain labs?
I think is that on your list of future advancements?
Yes,
Yeah, for
yes,
sure.
It's another one on my list, and I think that from what I heard, one of the future features in version 10 is the ability to have it turn off at a certain age, that you can program that. But I don't know if you're going to be able to program that you won't be able to see certain things in one account that's that's being proxy accessed by a parent. So that I don't know.
I know for my clinic, it's the pediatric patients and their parents. And Healow, they're the ones who seem to love the app the most. It's just so convenient for them.
Thank you.
Thanks, everybody.